Hi, my name is Viet Pham, and my presentation topic is about ketogenic diet. What is ketogenic diet? A ketogenic diet is a very low carb diet that are typically used for weight loss. In a typical diet, we consume fat, protein, and carb evenly. However, in keto diet, instead of using carb as the main energy source, your body will use ketones as the main energy source, which is from ketosis state. A typical macronutrients in the keto diet consists of 70% fat, 25% protein, and 5% carbs. So how does keto diet work? Well, when your body is when your body is low on carb, it will shift your metabolism into a ketosis state, which is a metabolic state that uses fat as a main energy source instead of carbohydrate. Since our body are used to um, use glucose from carb as the main energy source for our body, while in ketosis state, your body turns fat into ketones and use it as energy. Um, so how can we shift our metabolism into ketosis state? Well, the first few days of being on a keto diet is to focus on eating less than 5% carbs to put your body into a ketosis state. People started seeing result after a few days. However, the weight that they lost are actually water weight because our body is currently on a low carb diet. The glycogen stores in muscles experience a fall in water level. Therefore, our body also experiencing weight water loss. What are the benefits of keto diet? There are a few benefits to keto diet. It helps with weight loss, reduce the risk of having diabetes and cancer. Since the glucose level in our body is low, you will have a low insulin level and blood sugar level, which is what help reduce the risk of having diabetes. Another benefits are decrease inflammation, improve heart health, and help young people with epilepsy. What are the side effects of keto diet? Um, the side effects of keto diet are nutrient deficiency. When you are cutting out carb, which means you also cutting out vegetables and fruits. Since both vegetables and fruits are also contain carbs, which led to lack of all the micronutrients. And the other side effects are liver problem, kidney problem, constipation because of the lack of fiber from carb, and fatigue. The reason for some people will feel fatigue is because not everyone is used to a low carb diet, and this fatigue is very common for people who just started keto diet. Since our body is low on carb, which also led to a reduction of glucose that is produced to help um, our brain and other organs in our body to function. People can experiencing dizziness, brain fog, nausea, fatigue, constipation, etc. And these symptoms are known as the keto flu. Um, Keto diet in the long term. There are currently no evidence to support how well keto diet will support your body in the long term. However, in terms of weight loss, keto diet plateau can occur after a few months of being on diet. Some people, like once they being on a keto diet for a few months, they start not they're not losing weight consistently anymore, and they stop at a plateau. Um, a low carb diet could potentially lead to some of the side effects that were mentioned earlier. Um, is keto diet the best way for weight loss? Yes and no. Keto diet is good for weight loss in the short term. However, the lack of micronutrients could lead to many diseases. The USDA recommended that your diet should consist of less than 30% fat, 20 to 35% of protein, and 50% of carb to balance out your diet, and then that you can eat vegetables and fruits. In my opinion, the best way to lose weight is to stick to a 10 to 15% calories deficit. That will help you lose weight in the long term and is better for your overall health. In the picture on the right, it say that what to do and what to not do when you are trying to lose weight. What not to do is try to lose 20 pounds now, no matter the long-term cost. Well, that is not very healthy for your body. What to do is try to lose 20 pounds in a sustainable way that you could keep it off. Create a sustainable calorie deficit. Lift weight 3 to 5 times a week, and focus on consistency rather than perfection. In conclusion, keto diet is a type of diet that uses ketones as energy source instead of glucose. Keto diet is good to help kids with epilepsy for younger kids, but that should only keep into a short term, not in a long term, because they need to eat vegetables and fruits and carbs to introduce that later on to their diet, so that they can have all the micronutrients that they need to grow. Is good for lose weight, but like I said before, it's only good for short term. However, keto diet should only be used in the short term. Since keto diet will limit yourself from getting enough fiber and other nutrients from carbs and vegetables, you will not feeling very well and maybe not function as well as on a carb diet. And this is my word citation.